Hello, my name is Danbi Suh, and today we're going to be going over my initiative for supporting mental health for teenagers in Orange County. So this is our broad mission statement. This is going to be a multiculturally aware, school-based community project focused on enhancing youth leadership and peer support, as well as connection with outside local agencies, strengthen family participation in mental health discussions, and implementation of digital resources to increase mental health literacy. So that is a lot. There are a lot of different moving parts in there, but we're going to break it down. So first, let's look at the issue. So here's a bird's eye view of the problem. If you look at the graph, this goes into percentage of teens needing mental health services by race and ethnicity. But before we go into that, it's for all teenagers in Orange County, as reported by the Orange County Healthcare Agency in 2023, 47.1% of all teenagers in Orange County reported needing mental health support. That's almost half. I know. Okay, so then looking into that, the highest rates were with the Latino/Hispanic communities, where 52.5% of that group reporting needing mental health support, 46% of the white group, and then for mixed race, Asian, and Pacific Islanders, they had the highest rates of suicidal ideation at 17%. So as you can see from this, a wide range of students are struggling with their mental health, and so they do need support. However, there are some variations between racial/ethnic groups, so a multicultural lens may be beneficial. Now, we are going to look at the intersectional causes of mental health issues, or the root causes of mental health issues for this target population in general. One, a lack of education. A lack of education contributes to mental health issues because they might not even know that what they're going through is mental health. So then how would they be able to seek support? There could be stigma, there could be self-blame. So that is why this is going to be an important thing to consider across this project. Next is increased disconnection. In this day and age, of course, we remember the COVID pandemic, which made a huge push towards remote learning, work, etc. So cutting down a lot on that in-person engagement in group settings, one-on-one support, etc. And of course, isolation contributes to negative mental health outcomes. Cultural barriers, linguistic isolation. In Orange County, it's very diverse. We will go into that later, but there are a lot of folks who English isn't their first, second, or third language. So how will they be able to communicate, ask for help others? And there's also different historical contexts that separate some groups, but we'll get into that later again. And lastly, of course, socioeconomic barriers, change or differences in poverty, like income status, citizenship status, as well as those specific intergenerational contexts are affecting our Latino and certain sub-Asian subgroups much differently in Orange County. So we had a bird's eye view of the problem. Now we're going to look through a multicultural lens. So as you can see from this graphic, which is also available on the handout, 16.5% of Latinos/Hispanics in Orange County face poverty, 13.7% of Vietnamese, and 13% of Koreans as well. And of course, financial hardship will directly impact our mental health, most likely because it affects our stress levels, causes anxiety, depression. And now going into the citizenship status, 74.3% of Latinos in Orange County are not US citizens, and 70 to 72.4% of Korean and Vietnamese residents are foreign-born, which of course contributes to that linguistic isolation mentioned previously. And I did want to just make a specific note on the Vietnamese community in Orange County because, of course, from specific history, historical context, the Vietnamese Civil War, having refugee status, they suffer from specific economic, health, and educational issues because of their context. And so they do need a more individualized approach from other groups. Okay, so now that we have all of that information, and we probably need more time to marinate on it, but I don't want to take too much time. Now we have the information that has informed the framework to solve this issue or to address this issue. So first, I will go into the theoretical approach. So this project will be using the Bowenian Family Therapeutic Framework. This one was chosen because it focuses on self-advocacy and empowerment. That kind of just lends into the life skills, the self-sustaining, positive feedback loop that we want to create for our youth. So yeah, self-advocacy and empowerment, those peer support groups, working with their peers in the school setting, connecting to outside resources with the local agencies, starting those difficult conversations at home to make sure that it is aligning and appropriate with their cultural background. Because we don't want to, we want to have them integrated, their cultural history, who they want to be, and like their school and the majority group, etc. And of course, that also touches on the second bullet point there, which says culturally sensitive discussions on mental health. And second, the community systems. This is very community-based, open conversation, mixing of different groups. And by different groups, I mean the school, the outside agencies, the family, the self. So yeah, we will be engaging schools, families, and local organizations. So the what? Goals and objectives. Of course, the overarching one, fostering a self-sustaining community connection. So one is increase mental health literacy. Number two is strengthen multicultural community connections with your peers and with the outside agencies. And three, enhance family relationships regarding mental health. Okay, so that was the what, and this is the how. Implementation strategies, these are also listed on the handout. So collaboration is key. We would like to, of course, because this goes into the bullying and family therapy with empowerment and self-advocacy. So we will be collaborating with the target population, of course, themselves, and give them leadership positions in the peer support program, which I will go into next. But yeah, so collaboration, empowerment to the high school students, close cooperation and collaboration. How many times do I say collaboration? With the local agencies already invested, because there are luckily numerous ones in Orange County that are already supporting Orange County youth, multicultural connection, and education of mental health. And I'm going to quickly show you these agencies. There's NAMI and, okay, yeah. So there's NAMI, which focuses on mental health. There's the OCA-PICA in Garden Grove, which works with low-income families and youth, focusing on access, mental health, and mentorship for our Asian Pacific Islander youth. Access California Services works with the Arab American and Muslim American communities. MECA, which is great because it already links all these different groups together. It's a multi-ethnic collaborative. And then lastly, the OCHC is in Anaheim, and it promotes family and cultural connections for the Black community. I also noted local libraries and religious organizations there as well. Okay, so now for the program features, we have peer support programs, and this will be like the biggest focus of this initiative. So this is going to be very robust, integrated into the school system program, connecting students into mentor-mentee relationships, and this will be based on their backgrounds or shared interests. And integrated into that will be culturally relevant activities. So maybe we'll be linking them to all these other organizations, and they of course have different events, different resources, like mental health education, or maybe just community events based on traditional holidays, for example. For example, the OCHC, they have a yearly like Black Pride Parade, which is huge. And yeah, so for example, they could connect with peers, community, and family at that one. And the third point right there is integrating mental health education apps. So here we have Sanvelo and What's Up. These are widely distributed among youth. It's age appropriate. They offer coaching, therapy, self-care tools, cognitive behavioral therapy, and acceptance commitment therapy methods. It focuses on depression and anxiety, among other mental health issues, which are, depression and anxiety are huge for this target population. And I also put here that they will be available in multiple languages. At this current time, I couldn't find any free mental health education apps available in other languages, but with the peer support group, as well as our partnership with local agencies, we will put together materials available in different languages, which I think NAMI OC already has as well, just as a starting point. But we do want to have an abundant amount, an amount that will hopefully, level the playing field for our diverse communities in Orange County to decrease those linguistic cultural barriers. Okay, and of course, as we have been honing in, the organic supports, peers, community, and family, because we do want to kind of nurture and teach those life skills to continue um, just advocating for your own mental health well-being as you go on through life. These are teenagers that we're interacting with, soon to be young adults. And so we want to be able to teach those skills so that they can continue this wherever they go in life. Okay, so evaluation and accountability. How will we be able to tell if this is successful, if this is even helping the initial issue that we were trying to address? So there will be a questionnaire, a survey, basically, before the youth embarks on the program, and then at the end of the year. So this will be annual. And I can continue through the program every year. But yeah, we'll be comparing that pre-year and post-year questionnaire, and we can use questionnaires such as the PHQ-9, which is a like mental health questionnaire that is widely used, but this one is modified for teenagers. So yeah, there's that one. That one's big, and we'll also be adding questions to kind of gauge their like their cultural background, gender identity, sexual identity, things like that, just to make sure that there aren't other factors that we are missing. And because this project is so huge about community resources, community collaboration, connection, engagement, we'll be tracking that just to see if it does have an effect, if the students are using these resources, what are the barriers, so that we can continue to improve the initiative. And our bottom line, however, the success criteria, did this work, is to see if there's a reduction in reported need for mental health services, as well as improved literacy. Okay, so to bring this all together, the key takeaways. One, mental health is a critical issue for all adolescents in Orange County. Also, a multicultural lens is imperative, and I'm just bringing back in this graphic that we saw earlier. Again, also on the handout. And this initiative focuses on education, community connections, and family engagement to foster a self-sustaining, supportive environment. So that is my proposal to support teen mental health in Orange County. The next slides are just references, but thank you so much for your time. And yeah, thank you.